Hi, my name is Akwasi Boah. I am a neurosurgeon at the Texas Back Institute in Denton. I grew up in a family of medical professionals, and what I learned from them is that the most important thing to do is to make sure each and every patient has your time. In college, once I actually delved deeper into the patient care aspect of things, really drew me to medicine. And then in medical school, I just loved neuroanatomy to bits, and then actually getting to see it in an operating room just adjacent to us as a third-year medical student just hooked me in permanently. I think craniotomies in general I'm extremely passionate about, and even more so in the elderly, because the general idea or modus operandi is never to rush the elderly to the operating room, but unfortunately sometimes they need to have, an intracranial procedure done, and the stakes are high. Anytime you're exposing viable cortex, the stakes are high, but even more so in an elderly patient. So those cases I'm particularly passionate about. I'm a family guy, so I spend a lot of time with my family, and I play sports, play soccer, basketball a lot, and that really consumes between family, and I go to the gym too, so those things consume my time outside of work. I chose Texas Back Institute because it was the most unique opportunity I've ever been presented with. Being around another group with so many different ideas, so many different ways of doing things, diversity in people's backgrounds, it's self-explanatory. It's like, why would I not come to Texas Back? It means a lot. I mean, this is it's just a remarkable opportunity for me to deliver care to patients who otherwise would not have had access to such care. And I selfishly benefit as a physician from being around these guys all the time. So it's just probably one of the greatest opportunities I'll ever come across. Amongst my patients, my legacy will be that they truly felt that they were cared for, not necessarily just in the surgical aspect of things, because in fact, when we sit down and talk, I'm trying to steer you away from surgery unless it's 100% indicated, unless I know there's no way for you to get better or start on a track to getting better without it. The most important thing that patients need to know about me is that once I'm on your, once I'm on your side, once we've established a relationship, that's a very strong bond, and you would have, just a true advocate. There's not anything that's above or below me to do for my patient. This is not a dictatorship or even a democracy. We're totally bilateral. We're truly a team. So it's my job to try to educate you as a patient about certain things, but it's also your job to try to tell me how you feel about certain things, because not everything that I'm gonna suggest is necessarily appropriate for everyone. So we can't paint, everyone with the same brush. But that's the most important thing to know, that we are a team. So.